Next, you're going to perform the percussion part of the exam, and percussion is basically used to detect any fluid, air, or masses, and also to determine the size of organs, to detect any organomegaly or tenderness. You're going to start by percussing all 4 quadrants of the abdomen, and you're basically going to take your non-dominant hand and place it on each quadrant, and then quickly percuss with your dominant hand. And you would leave the any painful areas for last so that you could get through the exam. If you hear any dullness, that indicates the presence of an organ, mass, or fluid, such as seen in ascites, and you should be hearing tympanic sounds generally. To percuss the kidneys, you're going to use blunt percussion at the costovertebral angle, which is where the ribs meet the spine on the back. So you'll have the patient sit, and you will place the palm of your non-dominant hand at the costovertebral angle, and you're actually going to strike it with the fist of your dominant hand as such. The patient shouldn't feel any pain the first time that you percuss that area, and if they do have pain, then that could indicate pyelonephritis or possibly kidney stones. When percussing the liver, you're going to use the palm of your hand method. You're going to start at the right midclavicular line at about the 3rd intercostal space, and then start percussing downwards until you hear a dull sound indicating the presence of an organ. When you hear that dullness, you're going to mark it with a pen, and then starting at the midclavicular line at the level of the umbilicus, which is down a little more, you're going to actually percuss upward until you hear dullness indicating the presence of the organ. And then you're going to mark there, measure the distance between the two, and that will be the length of the liver. Normally it should be about 6 to 12 centimeters is normal. Then when percussing the spleen, there's a couple different ways, but the easiest way is basically to percuss from the left midclavicular line across the costal margin. You would percuss from the midclavicular line out to the along the costal margin up into the mid-axillary line, the left mid-axillary line. If the only sounds you hear are tympanic in nature, then splenomegaly is unlikely. To percuss the bladder, you're basically going to start at the level of the symphysis pubis and percuss upward, percuss upwards towards the umbilicus. If you're hearing dull sounds, that indicates a full bladder, and if the patient is indicating pain or tenderness while you're doing that, that indicates the presence of a urinary tract infection.